mallet finger deformity. So in this mallet finger deformity, you can see what's happening is the tendon of the extensor digitorum. Remember, it was having two lateral slips which joined together to have a common insertion onto the base of the dorsal aspect of the terminal phalanx, right? So this point of insertion of extensor digitorum and the terminal phalanx, that might get detached because of forced hyperflexion of distal phalanx. This forced hyperflexion of distal phalanx may happen during playing a volleyball or a basketball or by using hammer. So it might be an accidental injury as well. The splitting of the tendon of extensor digitorum from the terminal phalanx. And this will lead to unopposed flexion of the distal interphalangeal joint, because this muscle is going to take this advantage of flexing the terminal IP joint. And this muscle, is flexor digitorum profundus. So, because of the unopposed action of flexor digitorum profundus, there is hyperflexion of the terminal IP joint, that's mallet finger, due to rupture of the tendon of extensor digitorum at its point of terminal attachment. If this continues like this without getting any treatment, what will happen, because now there is a state of flexion here. Now these are the lateral slips of this yellow one is flexor digitorum superficialis. So this also weakens up. There are chances of going into swan neck deformity. So complication of mallet finger leads to swan neck deformity. And to prevent this, you can see here in this image how this splint has been used. So this splint is put in extension for the terminal IP joint for 4 to 8 weeks, 1 to 2 months.